But first, we have breaking news coming out of North Dakota after state health officials have confirmed 2 more cases of COVID-19. That's on top of the 2 cases we already told you about earlier today. The confirmed cases include a woman in her 20s from Cass County, a man in his 60s from Ward County, and a man in his 50s, along with a woman in her 20s from Burleigh County. Again, that brings the total number of confirmed cases in North Dakota to 5. Across the border in Minnesota, at least 60 have been confirmed positive. And in South Dakota, there are now 11 confirmed cases. At least 1 person has died from COVID-19 in the state. We're also following more breaking news this evening. Bishop John Fulda has canceled Mass, sacraments, and parish events in the Diocese of Fargo. That starts tomorrow at noon until further notice. Bishop Fulda tonight said it was a difficult decision to make, but acknowledges that the COVID-19 pandemic has led to extraordinary measures. His directive includes canceling all public masses, and events like weddings and funerals may only be celebrated with 10 or fewer people. You can find the Diocese of Fargo's full statement online or on the Valley News Live news app. As COVID-19 cases rise, keeping up with the numbers is tricky. That's because you've probably noticed numbers are often reported differently by different agencies. Tonight, Valley News Team's Lee Zurich looks at the CDC's delay in reporting cases.
The Atlanta-based Centers for Disease Control and Prevention, or CDC, has a slogan, 24/7, saving lives, protecting people. But that always working mantra doesn't appear to apply to its website, which provides critical information. The CDC has 2 web pages, one that updates the number of tests performed, the other the total number of positive coronavirus cases. But they're only updating Monday through Friday. They take weekends off. And those 5 weekly updates happen just once a day at noon. The agency responsible for tracking and collecting critical coronavirus data says on its own website our country has 4,200 positive cases. But our research shows the number is higher. In fact, a case tracker by Johns Hopkins has it at more than 5,000. The federal agency responsible for tracking this data is behind. We've been analyzing positive cases across the country to try and determine the hot spots. Right now, we've isolated on a few parts of the country. We have 4 counties that are tracking on a per capita basis way ahead of the rest of the country. 2 counties in the state of Washington, Snohomish, just north of Seattle, and King County, which includes Seattle. Orleans Parish, which is the city of New Orleans, is also tracking high, along with Westchester County, New York. That's a county north of Manhattan. A few more counties in the New York area have a high number of positive cases. But when you take into account population and the number of positive cases, some other counties across the country have higher per capita levels. That includes Fond du Lac County in Wisconsin, Williamson County in Tennessee, and Johnson County in Iowa.
The CDC did not respond to our requests for comment. North Dakota's Superintendent of Public Instruction said today Governor Burgum is looking into having school districts explore alternative ways of learning. That includes either a full closure of schools or a soft closure or an alternative way of teaching if all schools are closed. And that way, children wouldn't have to make up any days they've missed. That includes online learning. Officials say there's also a chance the extended closures will be waived and no days will need to be made up. There is no plan yet to extend the school closure in the state beyond this week. Also, the Minnesota House has approved $200 million to combat the disease. It will allocate $150 million for a new healthcare response fund, and the other $50 million will go toward ambulance services, clinics, hospitals, and long-term care facilities. With so much information flooding in about COVID-19, it can be difficult to absorb everything. So we turned to Facebook to see what questions you wanted us to ask health officials. Valley News Team's Katie Opperly joins us in studio to walk us through what you wanted to know and to give you the answers. Katie?
That's right, Andrea. We received over 100 comments. We won't be able to address them all right now, but to start, we picked 3 questions that were asked multiple times in the comments. Daycares were a large topic of concern, people asking if they will remain open, and if they do, how can it be ensured that they remain safe? We asked the infectious disease director in Minnesota.
We're asking that childcare would remain open during this time, but our recommendations for child care providers as well as the children are the same. If anyone has any symptoms, so respiratory symptoms and fever. Children should not attend daycare with those symptoms, and certainly if a child care provider has those symptoms, they should not be providing care.
Several people also wanted to know who is most at risk. Two people specifically wanting to know more about children who have pre-existing conditions. Experts say it's the same recommendation for kids with those conditions that it is for adults.
Our recommendations are that anyone that has an underlying health condition, so that includes diabetes, heart disease, lung disease, asthma. Those are all situations in which you want to be more cautious because individuals could be at higher risk for severe COVID-19 illness.
And with the recent news that Minnesota is changing its testing restrictions, many people asked, when should you be tested? And why not test everyone? In Minnesota, health officials are using their tests where they feel they are needed most.
We feel that it's our responsibility to make sure that we continue to have the capacity to test the most vulnerable Minnesotans. And so that would be individuals who are hospitalized, our healthcare providers, and individuals living in congregate settings.
She goes on to say that if you don't fall under this category and you only have mild symptoms, stay home and stay away from others. If your symptoms are more severe, that's when you should seek medical attention. Andrea?
All right, thank you, Katie. For more COVID-19 resources, as well as the latest closings and cancellations, we have links on our website, valleynewslive.com, and also on the VNL News app.
Don't stop living your life. You can't live in fear, but you do have to be careful. And this is one way we can do it. Is just if you're older, at risk, take a few more precautions.
Seniors and others at risk customers are being given priority for the first hour that Dollar General stores are open. Officials say they want to decrease their risk of coronavirus exposure by limiting their time inside the stores. Younger customers and those who don't fall into that at-risk category are being encouraged to wait on shopping until that first operating hour is over. Target is also dedicating an hour each week for the elderly and those with underlying health concerns to shop. Target also announced today that their stores will close no later than 9 p.m. starting tomorrow. The decision is to give staff extra time to clean and restock. In Minnesota, first responders are taking all the necessary precautions to keep themselves and their patients safe. Dispatchers might ask questions about what's going on with the patients calling for help, and that lets first responders know what they need equipment-wise before going into a home.
We also might wear a gown to help protect the uniform of our staff. One of the big things we want to do is make sure we're protecting not just the patient that we're seeing at that moment, but we're protecting the patients that we're going to see later in the day.
Almost as important for ambulance crews is what happens after those calls, making sure to prep and clean the truck for the next call. First responders and health officials are also pleading with you not to call 911 if you think you have the virus. Instead, contact your doctor or family clinic.